Um, the key regions of the brain that are affected with not with the interoceptive ability of the brain, where it can get kind of overloaded with symptoms. And, COVID's a good example there where the infection could be gone, but long haul COVID impairs the limbic system and the allostatic load and the interoception in the brain gets dysregulated. So we'll talk about the key regions affected and the role in cognition, emotion, behavior, as well as frequencies, the history and development of neurofeedback. I'm going to cover the core forms of what they do and the mechanism of change. There's a lot of them out there. I kind of focused for time's sake and my own sanity to cover the main ones. And then we'll go over clinical applications. Oh, let me back up. The brain is a dynamical processor. I actually added this in. I had talked to Stefan and I thought I had a 45 to 50-minute window to share, and he said, no, sometimes we go hours. So I said, goody, this is where I want to go over the brain as a dynamical processor. And then we'll cover some clinical applications. The typical ones that we see are ADHD, anxiety, and we'll look at the outcomes to see why neurofeedback is an essential tool for integrative medicine. Okay? So, what is neurofeedback? It is an EEG biofeedback, is a non-invasive neuromodulation technique that leverages real-time electroencephalographic data to facilitate self-regulation of brain activity. It's grounded in the principles of operant conditioning. And some history on that is in 1898, Edward Thorndike formulated the law of effect. In his work, he theorized that behavior is shaped by satisfying or by discomforting consequences. And a deeper explanation of operant conditioning is that the principles that Thorndike developed and then were later expanded upon by B.F. Skinner, who I remember studying in my undergrad degree, on how that focuses our behavior based on the experiences of the consequences. So Thorndike's law of effect laid the foundation of operant conditioning by stating that behaviors followed by positive outcomes are more likely to be repeated, while those followed by negative outcomes are less likely to occur. And the key principles of operant conditioning are basically, for an example, adding a rewarding stimulus to encourage behavior, or a negative reinforcement with an unpleasant stimulus to encourage behavior. Like, for example, taking pain relief medication to eliminate a headache, or another operant conditioning example would be punishment to decrease behavior. Or you guys follow me, it's just more of it's a neuromodulation based on the historical human condition and experience of how we want a desired outcome and we provide some sort of stimulus. So I will move on from there. Neurofeedback operates by capturing the EEG signals via surface electrodes or wire sensors, and then it processes these signals to extract relevant frequency domain or time domain features and then translates these features into sensory feedback. And different neurofeedback systems use it in different ways. It can be visual, auditory, or haptic through touch. Some systems, by rewarding desirable cortical activity such as increased sensory motor rhythm, coherence, or decrease high beta dysregulation neurofeedback, induces these neuroplastic adaptations which foster enhanced cognitive and emotional behavioral outcomes. So just a quick overview, it's non-invasive. It's a brain training technique. It uses real-time monitoring of electrical activity or cortical shifts in the brain, provides feedback to help the brain to self-regulate. And the sensors, we use simple EEG sensors to detect the cortical activity. And then depending on the neurofeedback system, it's generally a software that analyzes patterns and provides the feedback. That's the neuro loop. Brains learn to optimize their function, and then the goal is that central nervous system regulation would also improve. So I mentioned that we're going to talk about interoception. Basically, interoception is the ability to sense internal body states, for example, when you're relaxed or focused or anxious. It interprets bodily functions, whether you're thirsty, whether your heart rate is fluctuating, as well as emotions as indicators. It functions as an inner compass for physical and emotional regulation and can be heightened during stress, leading to a misinterpretation of danger. So that's what I'll talk about a little bit with the emotional brain, the limbic system I'd mentioned earlier, with symptoms like COVID long, where the infection is kind of at bay, but there's limbic system impairment, and it doesn't just necessarily have to be COVID long either, but that's part of our world now. So I bring that up because the brain doesn't really know the difference at this point, whether there's real danger or if it is a misinterpretation of danger. And interoception involves the emotions on how they originate from physiological responses. And so if you have a racing heart, then you often experience anxiety. Or if you have a allergic reaction, oftentimes we think that anxiety or generalized anxiety is the culprit, whereas it could be due to a histamine overload or mast cell activation, and they mimic an anxiety attack. And then, of course, when you're experiencing those symptoms, your brain wires for anxiety. As well, we recognize bodily cues because it aids in emotional regulation and resilience. And that's what we want when it's working properly. Allostatic load and how this comes into play is that it's the cumulative burden of chronic stress on the body. So prolonged stress can lead to systemic imbalances, including chronic fatigue. Actually, chronic fatigue syndrome, fibromyalgia are just pretty much COVID long haul. Mood swings, immune dysfunction, hormonal imbalances, and further effects on health can be HPA axis dysregulation. We have the overproduction of cortisol, which disrupts our sleep, or not just overproduction, but just production at the wrong times to metabolism and immune dysfunction. Inflammation, also part of allostatic load with chronic stress. It can often promote low-grade inflammation linked to various diseases. And then neuroplasticity and resilience. Strategies like neurofeedback and mindfulness can rewire the brain to better handle stress. And with practical applications here for patient care, we want to be able to educate patients on allostatic load and its role in chronic illness, as well as incorporating stress reducing techniques such as breath work, meditation, or having neurofeedback available, because that is a very easy, self-empowered thing for them to learn to do through the brain training systems. And we want to utilize neurofeedback as a non-invasive tool, just overall, to not only help the nervous system to learn how to recalibrate and regulate, but also to build stress resilience. Neurofeedback to enhance brain function would be that interoception affects self-awareness, stress regulation, and autonomic function, how the brain reads those sensations. The allostatic load reflects chronic stress's impact on the brain and body, and we know that. I think 90% is the statistic as far as how many people make an appointment with their doctor. It's a stress-related concern. 90% is a pretty high number. And so dysfunctions in interoception contribute to anxiety, ADHD, central nervous system dysregulation, as well as neuroinflammation. And neurofeedback directly trains the brain to help regulate these stress responses and dial back in where we can improve our interoceptive awareness to where it's normal versus hypervigilant, where people are constantly symptom scanning and stuck in this cell danger response, overloaded with stress in the body, and just super, super sensitive to everything in their environment. And be able to enhance self-regulation so that we can help the patient outcomes last to improvements in physical and mental health. I'll discuss linear neurofeedback as how it offers state-based training, and I'll explain that more in a little bit. And then what I'm most passionate about is dynamical neurofeedback because it trains the brain to optimize overall network connectivity in the brain and the dynamic coordination on how the brain is designed, focusing on real-time interactions between brain regions instead of focusing on states or regions of the brain, which historical neurofeedback does. So, in regards to interoception, I'm going to discuss more of how that's experienced in the brain regions that it affects. It primarily originates in the anterior insula, and this is not part of the limbic system, but it directly they're very close cousins. It integrates internal bodily signals with emotional and cognitive processing. That's the job of the insula. And the ACC, the anterior cingulate cortex, it processes and regulates those interoceptive signals from the insula, and it helps relate those to emotions and decision making. And then, of course, the hypothalamus, it regulates autonomic functions like heart rate, temperature, hormones, and hypothalamic dysfunction. Again, the hypothalamus is within the limbic system. When that system becomes overburdened, things like chronic fatigue, fibromyalgia, COVID long haul can become an issue. Prefrontal cortex is where our conscious awareness lies, our logic, our thought processing centers, where we can take that information and actually logically think it through. The insula heavily influences the limbic system by communicating with the amygdala, hypothalamus, and cingulate cortex, shaping emotional responses, stress regulation, and autonomic nervous system control. This dysfunction in the insula can contribute to anxiety, emotional dysregulations, and conditions like ADHD. I do have a citation link there. And by the way, I know this is recorded, but if anybody wants a link to the presentation, I'm happy to do that because I believe those links, if you're loaded and I've shared this with you, you can go right to the cited source. Patients with chronic illness often experience dysregulated interoception, leading to misinterpretation of the bodily signals. And so educating patients on interoception can empower them to self-regulate and reduce stress-related symptoms. Okay, I think it's important that we touch on this because the brain frequencies are a thing, particularly with historic neurofeedback and how they do it. Um, Basically, we have our gamma, down, beta, alpha, theta, delta. I have it in reverse order, but delta being where deep sleep is. There are infra frequencies under delta, but the main measurements are 0.5 to 4 hertz. Where deep sleep is, healing can occur here, cellular repair. Theta is 4 to 8 hertz, which is where if we're in a theta state, we can be daydreaming. It's oftentimes where we're more creative. Alpha being 8 to 12 hertz, we're more calm, relaxed, and we have more of a dialed in alertness. Beta is 12 to 30 hertz, where we can have focus and problem solving skills. And then, of course, gamma is above 30 hertz, where it's a high level cognition and peak performance. So it's important in neurofeedback because they directly correlate with different states of brain function, cognition, healing, which neurofeedback helps brain to optimize. And it's relevant because, well, I just gave you what they're associated with. Gamma's peak performance, mental clarity helps. Neurofeedback training can help improve focus, memory, and cognitive flexibility. And honestly, it's crucial for individuals with chronic illness or brain dysfunction. Beta is linked to active thinking, problem solving, concentration. Training in this range can help with cognitive clarity, productivity, focus, especially for patients. And historically, that's really what they had found is that it helped a lot with ADHD, but it also can help with anxiety or fatigue. And then alpha represents a state of that relaxed alertness and stress reduction. The alpha waves, that's kind of a misnomer. The brain does not actually wave, it oscillates. A wave is like moving, and your brain is not, the waves aren't moving, they're oscillating. So that's a misnomer. So alpha promotes a calm yet focused mind, helping patients manage anxiety and reduce stress and foster emotional balance. Theta is where our creative space is, emotional processing, deep relaxation. So neurofeedback training in this range can help individuals access deeper emotional insights and enhance relaxation, which is vital for stress recovery. And then, of course, Delta, again, associated with deep sleep, healing, restoration, and crucial for physical healing, cellular repair, as well as detoxification. Training in this range can improve sleep quality and accelerate physical recovery. Through neurofeedback, the brain can be in whichever frequency makes sense in the present moment. That would be the system that I use. It is not state-based training. And so it enhances overall brain function as well as and regulates stress. It helps improve both mental and physical outcomes. And I had a pop-up that said my connection is unstable, so I hope you guys can still hear me. Everything good?
Yes.
Yeah.
Okay.
Good.
Okay, let's get into the history here. I actually wasn't even going to include this, but I heard that I had more than 45 minutes, so I'm going to give you some background. And I think it's important because a lot of people just think that neurofeedback is just a recent biohack, but it's really not. It's been studied and developed for over 100 years now. In 1924, German psychiatrist and neurologist Hans Berger made a groundbreaking discovery by detecting the brain's electrical activity. He used electrodes placed on the patient's scalp and a ballistic galvanometer. Excuse me. He recorded small electrical currents, making the first ever measurements of cortical signals. This pioneering work led to the development of the electroencephalograph, or the EEG, revolutionizing our understanding of brain function. Berger's initial qualitative analysis laid the foundation for research into brain activity, shaping the fields of neuroscience and neurofeedback. In the 1950s, we had Yale had a neuroscientist, Neil E. Miller, and he revolutionized biofeedback by proving that autonomic functions, once thought involuntary, could be conditioned. He trained mice to regulate their heart rates through reinforcement and later demonstrated that humans could consciously control physiological responses like heart rate and blood pressure using auditory biofeedback. His work laid the foundation for modern biofeedback therapies in stress management, pain control, and self-regulation. In 19, did I move that slide in the wrong? No, my slides are out of order. Sorry about that. Something went wrong there because I went from 1950 to 1932. I'll have to fix that. The Fourier analysis is a mathematical method, and this is from German researcher. He was a pioneer in using QEEG or quantitative EEG by applying the Fourier analysis to 7 EEG records, enabling the breakdown of complex brain wave or cortical patterns into measurable components, and became the first researcher to apply the QEEG, allowing for more precise analysis of brain function. So what the Fourier analysis is a mathematical method used to decompose a complex function or a signal into a sum of simpler sine cosine functions. A lot of what neurofeedback is mathematics. And so it is used to analyze and represent functions in the frequency domain in the cortical patterns. Okay, we're at 1962 now, and psychologist Joe Kamiya conducted the first controlled study demonstrating that individuals could become aware and voluntarily control their brain cortical activity, laying the foundation for neurofeedback. In his experiment at the University of Chicago, subjects with their eyes closed were played a tone at random intervals and asked whether they were experiencing alpha waves at that moment. Initially, their responses were no better than just guessing or a chance. However, with the repeated trials and the feedback, some participants learned to accurately recognize when they were actually in an alpha state. Kamiya then took this further by instructing subjects to intentionally increase or decrease their alpha wave activity, which many successfully achieved. This groundbreaking groundbreaking research challenged the long-standing belief that the brain activity was entirely involuntary. It demonstrated that brainwave states could be consciously influenced, marking the beginning of neurofeedback as a tool for mental regulation and self-directed neuroplasticity, which is very exciting. Then in 1967, M. Barry Sturman, he's an American neuroscientist out of UCLA. He discovers the role of sensory motor rhythm, SMR, in seizure resistance, which to me, this is probably one of the most exciting times for what neurofeedback has done for people with epilepsy. Sensory motor rhythm is a specific type of cortical signal observed in the sensory motor cortex of the brain. It falls within the 12 to 15 hertz frequency range and is associated with calm, focused alertness, and it controls inhibition. SMR is particularly important for regulating movement and stability, and higher SMR activity is linked to relaxed but attentive states, while deficits in SMR have been associated with conditions like ADHD, sleep disorders, and epilepsy. So he started with cats and he wanted to see what happened and how resistant they were in epileptic seizures when exposed to the convulsant chemical monomethylhydrazine. He demonstrated a direct link between brain wave, again, brain doesn't wave, that's a misnomer, cortical training and neurological resilience. Then from there, since he initially used cats for his research before applying his findings to humans with patients with epilepsy, he did some work out of the University of California, Los Angeles, UCLA in 1971 is when he started using it on a human epileptic patient. And he found that the patient's seizures could be significantly reduced and controlled through the neurofeedback training. And his research paved the way for EEG neurofeedback as a non-invasive treatment for epilepsy. Then in 1976, Joel Lubar, an American psychologist and neuroscientist at the University of Tennessee, advanced EEG biofeedback research, and he built upon Sturman's work by studying neurofeedback for epilepsy and expanded the EEG biofeedback applications to ADHD and hyperactivity, and demonstrated that training specific brainwave frequencies could improve attention as well as impulse control. His research played a critical role in establishing neurofeedback as an alternative treatment for ADHD. Then move ahead to 1999. There is the development of the Neurooptimal and Zengar Institute software. We just celebrated our 25th year. And it is a fully automated dynamical neurofeedback system introduced by the Zengar Institute out of Quebec, Canada. Unlike traditional neurofeedback, which targets specific brain frequencies, Neurooptimal operates as a nonlinear real-time system that responds dynamically to the brain's activity through its auto-navigational algorithm-based software. This design provides a more optimized movement within the brain. So I'm going to go through the core forms. There's others, and like I said, we're constrained with time. So what I did is I took the main systems that are on the market today that are still being used. The first one being frequency power neurofeedback or historical traditional EEG neurofeedback. We'll cover slow cortical potential, SCP neurofeedback, low energy neurofeedback or LENS system, the Z-score neurofeedback, the Loretta system, the infra low frequency neurofeedback, and then again, dynamical neurofeedback, the neurooptimal system. So let's start with this one. The frequency band amplitude neurofeedback, which is that is historical. It's been around. It's still being used. I have a lady just down the street from me that uses it. She uses a different form than I do. And it is what we call linear EEG neurofeedback. It does require acute EEG. And the way it works is that electrodes, again, there's a lot of wires in this one. It detects the dominant frequencies of the brain activity, picking up on delta, theta, alpha, beta, and gamma frequencies. And in this, the software compares these frequency levels to an optimal target range. When the cortical activity shifts in the desired direction, the system rewards the brain with positive reinforcement. It's usually a pleasant sound or a visual, I had done this form of neurofeedback 10 years ago for dealing with chronic anxiety and chronic fatigue syndrome. And I would watch The Sound of Music or a movie, and it would disorient and change the screen if I was not on the targeted range. And then when I was, it would come back into focus. It was a little frustrating and it was quite stimulating. Over time, what happens is the brain learns to increase or decrease specific frequencies, leading to improved focus, relaxation, or emotional stability. At least that's the goal. It works because our brains are neuroplastic. The brain strengthens those pathways that receive that positive reinforcement. For example, if a person has excessive theta waves, which is common in ADHD, training reports helping with increased beta waves to help improve focus. And my take on that is most of these, pretty much any neurofeedback provider that provides this is going to give you a standard 40 session protocol, and it will entrain you to be in whatever state it wants you to be in. And then if you get stuck there, then they run another 40 session protocol to try to get you to another state. So it does have its downfalls. Slow cortical potential neurofeedback is where you use a very slow, detecting very slow electrical shifts in the brain's voltage, and it lasts seconds instead of milliseconds. This SCP neurofeedback trains the brain to control those voltage shifts, influencing cortical excitability and how easily neurons can fire. A positive shift makes the brain more alert and ready for action. A negative shift makes the brain more relaxed. This method reports helping with regulating arousal levels, helping with ADHD, epilepsy, and migraines. A person with epilepsy learns to stabilize their slow cortical potentials while reducing the likelihood of seizures. Then there's Z-score neurofeedback, and it compares to the real-time EEG data to a database of what normal brain activity based on a statistical or average model looks like, and identifies the deviations from normal patterns and provides feedback to guide the brain toward a more balanced state. I've heard Dr. Daniel Amen, and I'd like to quote him in this. He says that normal is really just a town in Illinois. And so it's the way I see some of this, and I'm a little biased, is that, I wear a size 7.5, size 8 shoe. Does that mean it's the optimal shoe size for everybody? And so that's why this state-based training I have some arguments based on it. And it works through real-time adaptation. It constantly adjusts that feedback as the brain moves closer to whatever that ideal range or quote unquote shoe size is. Examples of this would be someone with an excessive high beta wave, which is linked to anxiety or just not being able to shut your brain off because you're hyper focused. And it receives feedback that encourages a shift towards more of the relax. We're going to go down to a lower hertz or frequency in the alpha hertz pattern. Then there's Loretta, which stands for low resolution brain electromagnetic tomography. And it maps activity in the deeper brain structures. And it's not just using the sensors, it's a whole cap, and it goes a little bit deeper for picking up the cortical frequencies. It targets specific brain networks, particularly the amygdala for emotional regulation and prefrontal cortex for focus. And it provides feedback to encourage functional connectivity between different brain regions. An example would be someone with obsessive compulsive disorder or trauma, and it can assist the brain to train deep emotional processing areas to improve emotional regulation and reduce those OCD behaviors. Next, there's infralow frequency, ILF, trains the brain or cortical activity that is the very low the low 0.1 hertz, and it is slower than delta waves. These infralow frequencies regulate large-scale brain networks responsible for mood, stability, and self-regulation. Instead of training specific brain frequencies, the ILF neurofeedback system reports that it modulates the brain's self-regulation system, which is nice. It just helps support it, helping with chronic issues like anxiety, autism, or PTSD. If the brain is stuck in a hyper-aroused state, which is common in PTSD and complex PTSD, ILF training reports helping to shift it toward a more balanced resting state. which is a plus. And the dynamical neurofeedback or neurooptimal system is unlike any other form because neurooptimal does not target specific brain frequencies or have a set predefined goal. It constantly monitors brain activity and detects sudden fluctuations or oscillations, and then it will trigger a small auditory disruption, a click or a pause sound, and this pause makes the brain self-correct, naturally improving flexibility and efficiency over time. It works on the principle of non-linear dynamics, letting the brain self-optimize rather than forcing a change or to target to a particular state. It works on the premise of an invitation to the brain and the central nervous system instead of an intervention, thus allowing the body to be supported in its healing priority. It allows the brain to see what it needs to see, and then it can heal accordingly. An example would be a person dealing with chronic stress. They report becoming more adaptable and flexible to change and builds more resilience over time. So this is when I found out I had more time to share, I wanted to dig a little bit deeper here because of Carl Pribram. I'm not sure if you all are familiar with him. He died in 2015. He was almost 100. I think he was 96 when he passed away. Just an absolute brilliant neuroscientist. And he understood the brain as a dynamical processor, that the brain is not a machine. And traditional models viewed the brain that it was like a computer, that it had A to B linear processing, as well as it was just a chemical factory and it was neurotransmitter driven. Carl Pribram's holonomic brain theory states that the brain processes information dynamically, adapting in real time, and it uses holographic principles or patterns rather than static storage. And it works through self-organization rather than pre-programmed pathways. This is important because when you look at Dr. Pribram's, he was a pioneer in cognitive neuroscience and he bridged psychology and neuroscience, which is becoming more and more a thing, thankfully. We have such a mental health crisis in this country that I don't know if you guys have heard, but the Trump administration, this is a side note, has an initiative of combining, uh, well, shifting from mental health and spending the next 10 years focusing on brain health and neuroscience for helping people. And there's going to be a lot of work and money earmarked for that, which is quite exciting. Dr. Pribram bridged psychology and neuroscience, influencing research on consciousness and perception. He was a distinguished professor and author. He held positions at Stanford, Georgetown, and Radford universities. And in the context of the brain, dynamical refers to the constantly changing, adaptive, and interactive nature of neural activity. The brain is not a static organ. It is not a machine. It is not linear. Rather, it functions as a complex dynamical system, meaning that its activity is always evolving in response to internal and external stimuli. Therefore, it is ever changing and responding to internal and external stimuli constantly. It is not linear by any means. Dynamical is a mathematical term. And my son learns about this in his aerospace engineering program at the University of Florida because it takes into account differential equations. And I've heard him talk about that class, and I am not a math student. It's so high level for me. But dynamical systems are often described using differential equations, which express how a quantity changes in relation to another, and it typically involves time. And I'll share what the joint time frequency analysis is here in a moment. But differential equations are fundamental in modeling continuous evolution of systems in fields like physics, engineering, biology, and of course, neuroscience. Differential equations help analyze whether a system will settle into a stable state, will oscillate, or behave chaotically over time. And when it comes to aerospace engineering, for example, dynamical systems and differential equations are used to model things like flight dynamics, orbital mechanics, and control systems, all of which require precise predictions of motion over time. In his studies, my son encounters dynamical systems when studying how aircraft and spacecraft respond to forces, how control systems adjust for stability, and how celestial bodies move according to gravitational laws, all governed by differential equations. Sounds a lot like the brain. Dr. Val and Sue Brown developed Neurooptimal software as an algorithm that detects the dynamical changes of the brain for it to choose how to self-optimize. And this goes along with Dr. Pribram's theory that it works through self-organization, or as we have termed, synchronization through chaos, instead of pre-programming pathways or states. His research on neuroprocessing and the neural networks processes data as a whole, not as in isolated parts. The brain constantly adjusts, reorganizes in response to new stimuli. This is a bit of review. I already covered it, but it's good to note. Memory and perception function are more like wave patterns than stored files. The implication is that the brain's dynamical nature means it doesn't need fixing, but rather self-regulation. The five-phase model is something that Dr. Val Brown developed in neurofeedback, and it for the understanding that the progressive stages of self-regulation and transformation that happens in neurofeedback. And he emphasizes that traditional neurofeedback often focuses on symptom reduction by training specific brain frequencies, whereas Neurooptimal aligns more closely with the brain's natural dynamical processing based on Dr. Pribram's research. The nonlinear processing that it does highlights that the brain operates as a dynamical system, meaning its activity is not simply linear or mechanical, but adapts based on moment to moment needs. And in this, it allows the practitioner or the user to avoid overtraining. Because unlike traditional neurofeedback, which can overtrain specific frequencies, Neurooptimal works with the brain's natural self-correcting ability rather than imposing rigid protocols, which is interesting because a lot of the reasons why people seek neurofeedback training is because their stress regulation and their cell danger response in the body has become very rigid. And so, what we want to do with the dynamical neurofeedback is to break up those rigid patterns so that the cortical activity that has people being stuck can make a shift and can self optimize. A self evolving system is what this looks like. He describes the process as moving from rigid control to fluid adaptability, mirroring how human learning and development unfold naturally. Dr. Val and Sue Brown's work supports the idea that it is a congruent with the brain's natural design, as it doesn't force specific patterns, but instead allows the brain to reorganize itself, which is actually really, really important. I have a colleague of mine who contacted me with somebody that was very much in distress with their child and started neurofeedback, and it was not the type of neurofeedback that I use. It was a more of a medical intervention. And what I've seen consistently, I've been offering this system now for 3.5 years, is that when somebody is already stuck in a rigid pattern of being stressed, when you medically intervene, the brain already is on guard. So sometimes this type of intervention is so stimulating to the brain and central nervous system that you're trying to calm it down and the cost is too great. How Neurooptimal supports Dr. Val's five-phase model is that in phase one, where there's the instability, Neurooptimal detects that turbulence in the brain cortical activity. And in phase two, it's going to reinforce by the system providing that real-time feedback, helping the brain to self-correct. The integration in phase three is that the brain starts using more efficient pathways because the brain's always looking to move away from discomfort and discover the fastest way from point A to B. And phase four is that the flexibility happens within as the brain learns. It learns how to become more flexible and adaptable to change. The users report that it's more that they become better adaptable and they reduce their stress or their cell danger responses. And phase five would be resilience. And this, after a period of time of training, I've seen happen time and time again where brain function will stabilize and continue to self-optimize so that every time life throws you a curveball, you can handle it because you're adaptive and ever changing and you're dynamical as the design of the brain really is. So, despite there being several other core forms of neurofeedback on the market, I am wholeheartedly, because I've had a past with other systems and I'm trying to be objective, of course. I have some colleagues and friends, even from college, that actually are franchising neurofeedback clinics, and they use the historical form. And they have told me all the side effects and all the challenges that they have had. And I think that they're on the wrong side of the fence. Because Neurooptimal undoubtedly honors the body's innate design and intelligence to self regulate and self heal if given the opportunity. Plus, I really believe that it honors best the Hippocratic Oath as it emphasizes that in patient welfare, we're meant to do no harm. And since it's non-invasive and there's no side effects, it's more in line. So, how this relates to Carl Pribram's research is that his work shows that the brain operates on self-organizing principles, and Neurooptimal aligns with this by providing feedback without prescribing a rigid structure for adherence, but it encourages the natural adaptability rather than enforcing artificial states. And it allows the brain to self-optimize rather than treating it as a broken machine. Why linear neurofeedback falls short? Just in a nutshell, linear neurofeedback tries to force the brain into ideal frequencies or whatever normal is, and it assumes a fixed machine-like model of brain function, which the brain is not. It often requires a protocol-based training, which may not fit the brain's natural needs. And once that 40-session protocol is done, and if the patient goes from maybe high beta to getting stuck in a lower range, problem is they might not be anxious anymore, but they might lose motivation. And what I've seen, and I've heard this on several accounts, is that state-based training works similarly as a SSRI would, where it keeps your brain chemically in a certain state with side effects. People, they might not be able to cry anymore and not be able to live in that present moment that if it warrants you to cry, you should cry. Or if you need to be able to have a good night's sleep and wake up refreshed, that you do. Or, chemically SSRIs as well as neurofeedback, once they entrain you to a certain state or a certain frequency pattern, lock you in there, you do have those side effects. And their answer is, well, let's just run another protocol. And so I'm just not for that system. Neurooptimal works with the brain, not against it. It is nonlinear, dynamical approach, no forcing, just responding. All it's doing is giving the brain information about itself. It receives real-time information, it adjusts at its own pace, and there's no need for a diagnosis or setting correct frequencies. What I absolutely love about this, and Dr. Val actually got on a Zoom with me. I was very honored that he spent some time talking to me over an entirely different issue. But it was the first time I'd ever interfaced with him outside just DMing through our teams. I've heard him say this many, many times, but because I was trying to intervene by somebody with a patient that was working with another system, and they were doing the neurofeedback to deal with anxiety attacks. And once they started training more frequently, they started to have more panic attacks. And I thought, what is going on here? The cost is too high. And it was a 13-year-old. It was probably too much, too fast, and her brain knew it. And it felt like it was under threat. And so you have to ask yourself, this is what's different. When the brain recognizes and accepts that neurooptimal neurofeedback is actually just an invitation to the brain to give it information about itself, it allows the central nervous system and the brain to trust the process instead of feeling like it's being invaded or intervened and further driving the stress response. Here's what the system looks like. It is either on a Surface Pro tablet or on a laptop, and it's all you see there. It is a plug-and-play system. It can be made for clinicians or it can be used for personal use. I thought it was important to provide you with citations and PubMed studies on why the human brain is widely recognized as an intricate dynamical system exhibiting complex nonlinear interactions across multiple scales. While numerous studies have explored the brain's dynamic properties, pinpointing a single publication that definitively labels it as the most complex dynamical structure is kind of challenging. However, several scholarly articles delve into the brain's dynamic structure here, and I've listed them. Again, I can share this presentation so you can go directly from those links or copy and paste them. The brain is as a dynamical physical system. The study on that first link shows that it highlights the brain's nonlinear dynamics across various analytical levels. The article emphasizes the importance and understanding of these dynamics for comprehending brain function, and it is found in PubMed. The next link is the oscillating brain. It's complex and reliable. This research discusses the brain capability to generate diverse oscillatory patterns, underscoring its role as a complex dynamic system supporting various functions. Again, another PubMed article. And then finally, the brain is a complex system using network science as a tool for understanding the brain. This article explores the application of network science in unraveling complexities of brain function, highlighting potential for revolutionary insights when such methods are correctly applied and interpreted. So that we know, and how do you know that the brain is the most complex dynamical structure in the known universe? That's why I provided those articles, and it is able to process massive amounts of information, develop responses, and apply these responses for increased efficiency and mastery. Our brains are they're beyond our comprehension. Neurooptimal works using the brain's natural language through differences. It's detecting differences, and and this is why it's interesting. And this actually is some of the information that comes through. I am an instructor for Zengar, and I do teach the basic certification course. And so there's just some common sense principles here at play. Neurooptimal works by leveraging the brain's natural self-organizing intelligence through a process based on detecting those differences. And here's how it aligns with natural language of change and adaptation. This may sound repetitive, but it's important to understand that the brain is a dynamical system, and that Carl Pribram's research supports the idea that the brain functions as a complex, nonlinear, dynamical system, meaning it continuously adapts based on incoming information. Our system capitalizes on this by providing precise feedback to the brain about its own activity in real time. And the role of differences in learning is that the brain naturally responds to changes or differences in the sensory input. This is how we learn and we adapt. And Neurooptimal operates on this principle. Rather than pushing the brain toward a specific state, it simply alerts the brain to shift or alerts it when there's turbulence in the activity. It offers real-time mirroring by detecting those changes, like putting a mirror inside your head so that your brain can see what it's doing. It provides that feedback through brief interruptions of sound, like other neurofeedback systems, and it acts as a cue to the brain to organize and self-correct inefficient patterns without external direction. It does not impose anything. It does not target. It doesn't force the brain to any predetermined states. Instead, it encourages self-regulation and organization. And then the brain decide what adjustments are most beneficial based on the differences that it perceives. Let's move on to why, on common sense, this makes sense. Neurooptimal understands that there's not a norm that it is trying to achieve. We understand, for example, that babies have no one correct way to walk. The brain does not have a specific amplitude, strength of a cortical signal that is the right or correct amount. There is to a degree, I mean, when you are trying to outrun a grizzly bear, you don't want to be stuck in a theta delta state. You want to be in probably a gamma state where you're high focused and ready to roll. The brain doesn't have one specific amplitude or frequency because the cortical signals adapt to what's happening inside you and around you. And, I talked about interoception and allostatic load and then why that is important so that your brain can detect what's real and what's not, and it can help the body heal. The brain is always changing. The brain isn't fixed. It's flexible and it's self-adjusting. Its cortical signals shift moment to moment, responding to our thoughts, our emotions, our environment, and it can handle different tasks. Different tasks require different signals. When you're asleep, your brain signals look very different than when you're focused on a task. There's no single right amount what's needed based on what you're doing, and that natural variability is key because cortical signals aren't meant to stay the same. They fluctuate naturally, which means that the brain needs help in staying responsive and adaptable. Like learning to walk, this little baby here, when you're balancing and falling, you learn, you adjust. There's no bumper pads. So that, and honestly, I study a lot with some personal trainers and PTs, and all of the things that we have used that you've got at Babies R Us. I mean, I had my kids 25 years ago, and all of the bouncy seats and all the jumpers and all the things and the restraining things that we put our kids in, it it affected their development and how their left-right brain communication worked, their balance, how their cerebellum developed, how they the cerebellum is like the first thing that develops in an infant, and it helps with balance and motor skills. And when we don't allow them that left right brain communication where they go from crawling to walking, we see in their life that there's often some neurodivergent and developmental issues to deal with. So we don't want bumper pads. We want natural progression, and we want natural innate design and the intelligence of the body and the brain to be at work. Trying to force the brain into fixed numbers can be very counterproductive because every brain is unique. No two brains work exactly alike. There's no universal ideal pattern of activity. And what works well for one person may not work the best for another. Neurofeedback should support the natural brain function instead of trying to push cortical signals into specific ranges, assuming that there is an ideal. So we want to teach the brain to have autonomy to regulate itself. And the goal is efficiency. It's not fixed numbers, because a healthy brain isn't about hitting exact amplitudes or frequencies. It's about how smoothly and efficiently it can process information. So what happens when our brain is not able to smoothly detect change? This is when we tend to develop conditions, disorders, and chronic symptoms. When the brain is uncomfortable, we develop disorders or dis-ease. Process variability refers to the natural fluctuations or changes within a system over time. And in neuroscience, it describes the brain's ability to dynamically adjust its activity in response to internal and external stimuli, reflecting its adaptability and resilience. So think of process variability like driving a car on a busy road. If you always drove that car at exactly 50 miles per hour, regardless of traffic, the weather, the road conditions, you'd likely end up in trouble. Instead, you would naturally adjust your speed, slowing down for traffic, speeding up on an open road, or stopping at a red light. Similarly, your brain constantly adjusts its activity, the cortical signals, based on what's happening inside and around you. If the brain loses this ability to adapt, it can lead to mental or physical imbalances, just like rigid driving would lead to accidents. So again, our brain is infinitely cycling and self-regulating. We understand there are no absolute values that are inherently best for the amount of activity required for specific functions. It always varies from brain to brain, and it always varies with time from that same brain. In other words, our system generally regulates to around a blood pressure of 120/80 or to a temperature of 98.6, but this does not stay constant, nor is it fixed. Detect and train specific amplitude and frequencies of a brain cortical pattern activity. Electrodes on the scalp measure raw EEG signals in all these systems. And the EEG is broken into frequency bands. They look for data, theta, delta, theta, alpha, beta, gamma. I need some coffee. Target specific frequency ranges, adjusting amplitude to meet training goals. And it assumes that certain cortical patterns respond or correspond optimally to suboptimal states, conditioning the brain towards whatever that desired or normal range is. And the limitations is that it assumes a universal ideal state for all brains, and it has a risk of overtraining or dysregulation, creating new imbalances and a delayed feedback that can actually may not capture real-time brain activity. Making sense of the EEG chaos. Let me go through this first. With the amplitude and frequency based detection of historical neurofeedback, the oh, I just covered that. I'm sorry. If the targets are specific frequency ranges, either increasing or decreasing their amplitude, are always based on the predetermined training goals of the practitioner. And that is a concern to me. I kind of feel like some of these people that read acute EEG and build a protocol, because I had it done, it helped my anxiety, but it made my chronic fatigue infinitely worse. And I did feel like the psychiatric nurse that was doing this for me, I was a little bit of a marionette puppet. The system assumes that a particular brain or cortical pattern corresponds to an optimal or suboptimal state. And again, it's not ideal for everyone. So I know I'm repeating myself over and over again. I just really believe it's very, very important that we don't just look at amplitude and frequency. So with our system, we take into consideration the joint time frequency analysis. And this is where the intricate workings, I can't tell you all the ways that it works because it's proprietary. And there's a reason Dr. Val and his ex-wife are so successful because it is proprietary. And we're always learning about the brain. But this is a controlled procedure that we say is basically looking at the brain and it is synchronizing through chaos. It is using a mathematical process that's able to measure and give feedback data to the central nervous system about the electrical activity of the brain. Instead of isolating and training specific frequency, it continuously monitors real-time shifts in brain activity across time and frequency simultaneously. It's crazy because it processes that information at 256 times a second, and that's only because that's as fast as Microsoft can compute it. The system does not assume any ideal states of the brain. Instead, it just simply detects moment-to-moment fluctuations, giving that information back to the brain. So it's just more effective because it is more in tune with how the brain works, and it doesn't overtrain. There's no side effects like fatigue or headaches or emotional dysregulation when frequencies are pushed too far in one direction. It avoids this because all it is doing is giving the brain information about itself. So I don't want to beat a dead horse, but let's talk about development and just some common sense things here. Crank starts on a car would be a little bit how early neurofeedback was. It was overly rigid, very manual. And in the early days of automobiles, you had to manually crank the car engine to start the car. It was a rigid step-by-step process requiring precise effort and technical know-how. Similarly, early neurofeedback required heavy intervention, manual adjustments, and strict protocols, assuming the brain needed to be fixed in a stepwise manner. Like a crank start car, early neurofeedback required a lot of effort and wasn't adaptable to real-world driving conditions or, in this case, brain states. Then, as neurofeedback developed, similarly, we have manual transmission. This is with guided training. As technology progressed, manual transmission cars became more efficient, but they still required the driver to shift gears at the right time. And the five-phase model works similarly. Neurofeedback specialists carefully guide the brain through preset training processes, adjusting protocols as needed. And the process is structured, but it assumes the driver or the brain won't shift correctly without intervention. While more effective than cranking, manual transmission still relies on the driver's skill, just like the phase model relies on the practitioner protocols to guide the brain. And more advanced automatic cars, they're still a little bit structured. They make driving easier. There's no need to shift gears, but you still have to steer and be fully engaged. Some neurofeedback systems today are like automatic cars. They remove some manual work, but still require adjustments, monitoring, and intervention. The brain is given some freedom, but the system still dictates structure phases instead of allowing self-regulation. Like automatic cars, these systems reduce effort, but don't fully allow the driver or the brain to operate autonomously. Welcome to the future, my friends. Self-driving cars, uh, similar to what Neuroptimal does, if you like my analogy here. The latest innovation in car technology is self-driving cars, systems that adapt in real time to road conditions, traffic, and the driver's needs without requiring manual control. Neuroptimal works the same way. It provides real-time feedback, allowing the brain to self-correct without needing structures, training, or phases of manual adjustments. Just like self-driving cars make moment-to-moment calculations for the safest, smoothest rise. Neuroptimal provides the brain with instant feedback, enabling it to optimize organically. And it's all programmed into its auto navigation. It's an algorithm in the software that when it detects changes, it alerts through the neurofeedback audio loop. And it doesn't force the brain through structured phases, which is where a healthy brain and central nervous system lies, where it is always in the present moment. Here's the feedback loop. It's very simple. I can't see my screen, so I'm going to kind of open it up a little bit here if you guys can see that. The voltage fluctuations are measured on the EEG signal. Neuroptimal software analyzes it at 256 times a second, detecting four ways, which we call the duration, intensity, frequency, and shifts. And any external noise is cleared out by the other sensors that are attached to your ears. Then it goes into the amplifier and it converts it from analog to digital. And then the information is fed back to the individual by slight interruptions in the media stream. And the central nervous system responds and adjusts as natural indication that changes the internal external environment have been made. And this is where personal transformation occurs when the individual trains towards flexibility and resilience and they perceive internal external turbulence for what it is. And it helps our interoception kind of dial in better. And overall, we want the allostatic load through using this system to decrease as well. I think it's fair that because you guys have probably ran across this, you might have seen them. There are some other neurofeedback devices that are on the market. There's the Narbis smart glasses. It uses built-in EEG sensors to monitor brain activity, particularly focus and attention levels. The lenses will actually darken when focus shifts and clear up when attention is maintained, providing real-time visual feedback to help improve concentration. There's the Muse headband. That one's popular. It's a soft EEG-based headband that tracks brain activity, heart rate, and breathing. It provides real-time feedback through an app on your phone, using soundscapes and guided meditations to train the brain for improved relaxation, focus, and sleep. There's the B Medic NeuroAmp, a professional neurofeedback system used in clinical settings. This captures EEG signals and provides tailored feedback through visual, auditory, and tactile stimuli, allowing patients to train specific brain or cortical patterns. There's another one. There's a new technology. Now they've been around since I think 2004. And their name escapes me. I have it in my notes somewhere. The developer called me from Italy. He was at a biohacking biofeedback conference in northern Italy, presenting his software there. And it is, again, an entrainment. He said it's functional neurofeedback, and he assured me as a naturopath that it worked along with the body. But as he told me how it worked, it was very much like this Medic NeuroAmp, where it is targeted training to keep you in a particular state. Then there's the Mendy neurofeedback. That's another one that's popular, like the Muse headband. It's a headband that uses near infrared spectroscopy, an NIRS or NIRS. It's measures brain activity and blood flow. And that's a little bit, I mean, it's biofeedback, I think, combined with neurofeedback. It provides real-time feedback through a mobile app, encouraging users to train their prefrontal cortex for better focus, mood regulation, and cognitive function. And the issue with some of these, like the Mendy versus the Muse, is just their lack of efficacy. There's poor signal quality and artifact contamination because they're kind of gadgety. They aren't using EEGs in the same way. The clinical neurofeedback uses advanced artifact rejection to filter out noise from muscle movement in the EEGs that we use. Things like blinking and external electrical interference, they are canceled out. However, with these consumer grade EEG devices, they struggle to distinguish between real brain activity from movement and artifacts. And if you're going to be wearing one of these, you don't want to be chewing gum. Muse and Mendy, for example, are highly susceptible to motion, noise, and environmental interference, making their feedback unreliable. And those glasses, the first thing that I listed, they rely on blink detection, which is not accurate measure of cognitive engagement or brain activity. What happens if you have dry eyes and you have to blink more? You're going to have trouble using that device. So this means this training is often based on false data, leading to ineffective or misleading feedback. Okay, typical neurofeedback users, children and adults with ADHD, ASD, and learning disorders. I know at Zengar Institute that 75% of the people that buy our systems are moms that are trying to help their children. They either have social anxiety disorder, ADHD, they're stuck in a stress overwhelm, and it's never just typically one condition. ADHD, if not handled and supported properly, I've dealt with people in their 70s that got diagnosed late in life with ADHD, and of course they developed social anxiety disorders and generalized anxiety disorders because they just never felt like they could handle what everybody else was doing. Their ability to learn in that structured type environment didn't work. Same with neurodivergent families. I don't know if you docs have been familiar with this as I have, but I'm starting to see multiples of children that are on the spectrum and not just one family member. I'm seeing multiples, and I don't know how these families can handle what they've got to do. So I sell them a system so that they can all train and support themselves. Those with sleep disorders are typical neurofeedback users. One of the really, by and large, as far as our reports and our findings and all of the millions of sessions that we've run at Zengar Institute, then across the board, the number one thing that people notice improves overall and often first is their sleep. Also, people seeking cognitive and emotional balance or focus, individuals with anxiety, PTSD, and mood disorders are perfect candidates to train. I love working with veterans and first responders because their cortical patterns get stuck and they need help. I also work with some of world record holders in their sports. Peak performers, athletes, executives, and creatives use neurofeedback to just better themselves and to make their brains operate better. And also, and this is kind of where I landed on neurofeedback because I came from the chronic illness and pain community. Some clinical applications, and I wanted to provide you with, on the next slide, a lot of citations that you can have. Excuse me. ADHD studies show that 30 to 50% improvement in symptoms compared to stimulant medications by using neurofeedback. Anxiety and post-traumatic stress disorder reduces the amygdala hyperactivity and promotes emotional regulation. Depression and enhances prefrontal activity, improving mood and cognitive function. Insomnia, where it regulates the sensory motor rhythm and helps with better sleep. And then chronic pain, because it modulates pain perception, because of cortical reorganization, again, where those persistent, consistent cortical patterns where the brain can get stuck. Whether the infection's gone or the broken leg is over with, our brains sometimes don't know the difference when it gets stuck. Here's some clinical application citations. I wanted to provide a handful of clinical citations for you. There are, of course, countless more. I chose these applications based on common complaints, as I'm sure you can attest many of your patients deal with those issues. This breaks down clinical applications by specialty and who can add neurofeedback into their practice: neurologists, psychiatrists, therapists, pain management docs, and sleep med docs, because it helps with concussion recovery, epilepsy by reducing seizure frequency. Psychiatry helps with ADHD, anxiety, depression, autism, PTSD, depression, fibromyalgia, migraines, chronic pain, and helping to correct sleep disorders. And then here is peer-reviewed study based on each of those under neurology, psychiatry, pain management, and sleep medicine, where you can see the peer-reviewed research on that by specialty. And then just to sum things up, neurofeedback is a viable option for patients and integrative doctors due to its non-invasive nature and its ability to address a wide range of neurological and psychological conditions by directly training the brain to regulate its activity, its own activity, for it to see it and optimize it. Neurofeedback can help improve cognitive function, emotional regulation, as well as mental clarity. It offers a personalized, drug-free alternative or complement to traditional treatments, making it particularly appealing in integrative medicine, where a holistic approach, I hope, is prioritized. Furthermore, its potential for enhancing performance, reducing stress, and managing conditions like ADHD, anxiety, stress-related conditions. And it makes it a valuable tool for both practitioners as well as patients seeking long-term sustainable outcomes. With its growing body of research and positive clinical results, neurofeedback represents a promising, versatile option for improving brain health and overall well-being, and most certainly beneficial over medications. So I've provided a simplified comparison chart here based on neurofeedback versus medications, side effects, minimal to none. Medications, it's common that people become dependent on them, and the long-term benefits that you have sustained training. Once your brain, if you're not doing state-based training and you're doing the dynamical training, the brain never forgets. So if you have worked through issues and life throws you another curveball, you can continue to train because your brain can always self-optimize. The long-term benefits of medication, they're often temporary, but not always. Some people don't have a thyroid anymore and they need to take their thyroid. So no worries with that. Individualized treatment or training, yes, with some neurofeedback systems, QEEG is required and a protocol is required, but not with the system, the dynamical system, because it is auto-navigational and mimics the brain's design. And the individualized treatment with medication is, not typically. It's usually your guinea pig, trial and error, or there's just standardized dosing. And then, of course, it trains the brain to function better and self-optimize. And when it comes to affecting health, medication will chemically alter the body's ability to either cell surface receptors on the reuptake of medications, or it just alters neurotransmitters entirely. Here is my contact information. I wanted to thank you, everyone, for being here and letting me share. I tried to provide an objective information, but you can tell I'm biased on the core systems that are out there. But as a naturopath, I've worked with clients the last 3.5 years providing neurotraining. I do offer a different neurotraining. I do some vagal nerve training as well. And what I've seen is with the client patients, sorry, it says my connection is unstable. I'm not sure if you can hear me. with the client patients that I've had a vast array of issues, and I've learned that it's imperative that we honor their stress response as to not further fuel them as individuals. You know, they're seeking help, they don't feel well. There's been a cell danger response or a stress overwhelm response that's been activated. And I want to be able to work with them and waltz the waltz. It's a client-led process. They do look to me for support, and I will guide and direct and make it available. But I allow for the invitation to be the avenue to improve their health and their resilience. And I don't try to force an intervention because the brain is smart. The nervous system is smart. When it's overwhelmed, sometimes I know it's crazy, but I have people that will run from doctor appointment to doctor appointment to this, to that, because they're miserable. They don't feel well. They want their anxiety to stop. They want their chronic pain to stop. And sometimes trying to make it stop further drives the stress response. And I'll sometimes challenge people that maybe they need to just not do anything for a while and let the body recalibrate. So I try to honor the innate design of, as a naturopath, that the body knows how to heal, that it has the innate ability to do so if we stop the wrongdoing and we get out of the way. And so if I can make this type of technology available that empowers them and it can be a life change and it allows the brain and body to determine the healing priority for brain optimization, that's what I support. And so just to wrap it up, one of my favorite quotes is that a better brain means a better life. Thank you so much.
Thank you. Dr. Nario, do you have some questions from the audience?
Yes, Dr. Marley, thank you so much for that great presentation.
Thank
So
you.
this is I got first dibs, I guess. So this is a personal question on my end because in Arizona, as I do the integrative medicine fellowship, we are
Mhm,
being taught on how to meditate, and also in relation to this gets us into a better alpha wave most of the time.
mhm,
And
mhm.
also yoga has been noted to be reaching good theta waves as well. So in this situation, what modalities, natural modalities or external device modalities, can you combine with this device?
Well, with what if are you talking about the device that I use? Or are you talking about other
Yes.
devices?
Oh, no, no, yours. The
Mm,
Optimal.
with ours. Okay.
Hmm.
So with things like yoga and meditation, they pair perfectly because there. We do instruct, I work with a lot of therapists that add this technology to their practice. And things like EMDR, which physiologically works, but at what cost? I'm not a huge fan of EMDR because it is asking the brain to go somewhere that it really didn't want to go. And so I always say that our training that we offer with the dynamical neurofeedback is like the easy passive backdoor approach to trauma resolution. So if there's not anything that's considered an intrinsic constraint where the brain has to compete to self-regulate, things like yoga would enhance it and meditation would enhance it. And in fact, the users that I have that are very good at meditating, they say that using the neurooptimal is like meditation on steroids for them.
Right.
So I love
Yeah.
that you have
Mhm.
that available and
Mhm.
that you're doing that for people.
Right. What about these other externals? Like I know I don't know if you're familiar that, like, for example, ketamine
Ketamine
involves the
therapy.
enhancement of gamma, yeah, activity, even
Yeah,
psilocybin with the alpha, and then ayahuasca also going
yeah,
for the alpha and gamma. I mean,
yeah.
what are your thoughts about these kind of unconventional ways?
Well, I always have to ask, like, what's the cost? Is it too stimulating to the body and further drive the stress response? And so things like ketamine and psilocybin and ayahuasca, like ayahuasca especially, I mean, it's pretty toxic. Psilocybin, whether it's microdosed or not, I think I think I'm going to lean in a little bit more to my Amen clinics training is that a lot of those things impede blood flow to the brain. And so overall, it's not, the jury's out on ketamine as well as psilocybin. Ayahuasca, I mean, that and some of the other things. There's an ayahuasca provider in Orlando, and so I've had some discussions with people that have been there because I'm just outside Orlando.
Hmm.
And I think with anything is the toxicity of the trauma, the toxicity of the pain, harder on the body and the central nervous system than the treatment. And so I always kind of land on that with people is that, even if you needed to take an antidepressant for whatever reason, whether you literally, say you don't absorb lithium well and minerals aren't working and you've tried all the natural medicines and you still need to go on Prozac. Well, it's not holistic, it's not ideal, but neither is feeling depressed. So at what cost? I always kind of land on that. Like, what is it costing the body? What is it costing the quality of life? And if you need to do that for a while to work on those other things, and then, use that as a stopgap measure, but I don't think, I mean, like with ketamine, I know it's done phenomenal things with people with complex trauma and it's probably worth it. But I've also had people come to me after doing it and they were traumatized by the whole process.
Hmm.
So I don't know if I can give you a full definitive answer on that.
Yeah, and there's these are. I mean, I'm not saying everything on that list was trending, but ketamine for sure. You would
Mhm.
see ketamine IV drips. I mean, of course, these are medically guided for
Sure.
procedures, but it's definitely out there. And as you could see, that your device kind of has its overlap, basically.
Yeah, no, I think what I think is that you could I always encourage people to add brain training in because it's gentle. It's going to just train the brain to be better. But if you are using those therapies or on medications, the goal as the brain can self-optimize is that you titrate off of them.
Right. Yeah. So one question here is saying that it sounds like you mentioned about the products, the commercial products out there. And I don't think anything's favorable there, but anything there that you can recommend at least if they can't do your process, I think something closer to your standards for them to buy.
Yeah, I have not tried those. You're talking about the devices that
Like
I'd
the
shown.
Muse, yeah, the
Yeah, the
ones that
Muse
you
and the
showed.
headbands.
Hmm.
I based on like I don't know that I have an opinion on that. I think I would probably do my own research and there's even more than these. These are just kind of like you said, the ones that are trending. I
Hmm.
know that with the system that I have, if they cannot find a trainer locally, I can ship them a system because I rent them and I can ship them anywhere.
Hmm.
And so it can be very, very cost effective, particularly if you rent a system. Like, my in-person sessions are relatively inexpensive because I live in a county. Well, part of it is because I come from the chronic illness community and I know what it's like to not have money and trying to be outside the box with medicine because Lyme is so complicated and not, you know, having allopathic help to treat it and looking for help. So I've priced mine lower than a lot of places.
Hmm.
But for a rental, say for a family of four, I charge roughly $79 a session, about the price of a massage.
It's not
But for a
bad.
family of four to rent a system over a month, And if they use it once or twice a day, it works out to like $5 a session. So
Right.
rentals make a lot of sense for families, particularly because it's a training. It's a um, we are FDA approved, Health Canada approved as a wellness device. And unfortunately, it's not an insurable product. I do take health savings accounts, which is helpful. Hopefully, we'll eventually, like with anything. I remember when chiropractor wasn't covered, and acupuncture finally is too. So hopefully, we'll get there. But it it is within reach, and if I could, in some ways, have this technology in the hands of every school, every fire department, every church, every therapy office, every functional integrative doctor's office, every psychiatry office, because this is such a tool for change. And I'm convinced that as people can change their brain and improve and regulate their nervous system, I could solve world peace. I know I could. It's
Right.
remarkable what it does.
I already have ideas on how to use it in my own practice. I mean, we have an
Mhm.
IV room here. I'm assuming you can definitely do this while
Yeah, it's
you're getting an
perfect.
IV,
Yep. Yeah,
right?
it's 100%. There's a lot. So I have my systems, I rent them, I sell them, and I have them. I share space with an acupuncturist, and we sometimes have people doing acupuncture with the training because it's an audio only. So the cool thing is you can multitask.
Right. Oh, you don't
A
have to be
lot
in
of
a
people
Zen
take a
mode.
nap.
Yeah, sitting
Sorry?
on you don't have to be like sitting in a lotus position for this.
No, no, not at all. A lot of people are
Okay.
just, they can sit at their desk and train. If you want to work on emails or talk on the phone while the system's running, it can work. We say we will want you to do what encourages training. The brain filters it out, it knows how to process, and the system works whether you're paying attention to the audio cues or not, because the brain is processing it on, only like 5% of our logic centers cognitive awareness is what's actually working in our brain. The rest is subconscious, unconscious. So
Right.
it's remarkable what you can do. So if you do have an IV place, it's perfect. I've set up docs' offices with that exact thing. They're doing a Myers cocktail and they're brain training at the same time. It's great.
Right. It sounds like it's a
Yeah.
good combination. But you did
It's
mention that this is not covered by insurance. So that was one of the questions, right?
Yeah,
Is that correct?
because of FDA compliance and approval, it is considered a wellness device and not a medical device. Now, I'm not one to do this because I'm not a licensed doctor in the state of Florida. But other licensed doctors or therapists have somehow made it umbrellaed that if they include that in, they bill it at a certain level. I don't know how that works, but
Right.
I know people do that. Yeah.
But it sounds like this is more for professional use because you're saying the public gets it through you by you letting them rent it. Is that correct?
No, not necessarily. These systems are actually plug and play. They're designed for people to be able to use at home because of the auto navigational software in it, and that there's no requirement for a QEEG or protocol. So there's two systems that Zengar offers. There's a personal system that is less expensive and it is preloaded. Sorry, it says my connection's unstable. So tell me if you can't hear me. They're
You're good.
preloaded with Okay, they're preloaded with like 100 sessions. Those systems are less expensive, but they don't make a lot of sense. Excuse me, to purchase those because the professional systems people will buy for personal use as well because the system is unlimited. And as long as you're licensed with the software, any upgrades, they're all included. So ultimately, what often can happen is people will come to you as a clinician, and Zengar is supportive that if you want to just provide sessions, You can do that. But if you wanted to provide rentals and families that come from out of town, then you can have an income stream with rentals. And that's what I do. I have in-person sessions, I provide rentals, and I also do system sales. So if there was a family that decided, our family needs this, we want to own our own, then if you are a part of the Zengar community, then you earn a referral commission as well.
Got so it is available for the public, and it sounds like you have a lot of I guess clients who are also doing that.
I'm sorry, I missed the first part of what you said.
Oh no, meaning it is available for the public. It's not a professional device only use, like a medical
Yes, but
professional only.
because of the cost, it generally is more professionals that buy it.
Sure.
But it is made available, and that's been the heart of Zengar from the beginning, is to make it available to relieve suffering for people, and that it is a self-empowerment experience for them, so that, really to lead our patients to health and empower them versus always just looking for us to fix it. So it
Right.
works well with that model as well.
Okay. And here's a something I think this is in relation to how you were discussing going through the different stages, brain stages. Getting stuck. You mentioned about getting stuck. How are you getting stuck? I mean, can you get out of that real quick, or are you doomed when you get stuck? I think that's what the question meant.
Yeah, well, before my brain was healed, I had chronic mold toxicity that I grew up with. So I was sick from the time I was in grade 4. And then I had multiple head injuries that developed into um, pretty significant panic disorder and anxiety and depression. And then I got Lyme disease in 1999. So I had, up until about 5 years ago, I had a lifetime of being stuck in fight or flight. And just a chronic baseline level of anxiety, hypervigilance, overwhelm all the time. And so my cortical patterns were stuck. And, those neural pathways, they're kind of like wagon ruts that run really deep because your brain is designed to keep you alive, and it is always, always learning through patterns. And so if you've had that horrible experience, whether it's to me, trauma's on a spectrum. You could have had a high A score as a child and developed all kinds of mental health issues, neurological coping mechanisms that, whether it's, tics, or it's a, a obsessive behaviors or addictions, whatever, because your nervous system gets dysregulated and feels stuck. And then you start looking for things to feel safe. You start looking for things to distract you or to numb the feelings or escape it. And when you're living in that and you never get a break, you get stuck. And so the beauty of this brain training, as it does, is that the more you train, it interrupts those cortical patterns that your brain gets stuck in. And it shows them, then your brain can see it and then move away from it. And it's that process where, as you continue to calm and regulate the nervous system, and you start realizing your window of tolerance to stress continues to increase, and then your quality of life can improve as well. And those things that used to kind of set you off or overwhelm you, because we can't avoid stress. We can't. As long as we live in this world, we're going to have stress. But we can help the brain to be able to manage those changes. And that's what it is. When your brain gets stuck and it gets rigid, it wants to predict the next 5 seconds because you're always bracing yourself when you're stuck in those patterns, right? And so I don't know if you've had any patients describe it to you. I don't know if you work with people with these disorders, but their interoceptive awareness is all out of whack, and then their allostatic load just gets more than they can handle, and they just stay in this fight, flight, freeze, fawn state, and life is not good. So we
And I
want
see,
to
yeah,
help them
that's
get
right.
unstuck from that.
Yeah,
Yeah,
I see this a lot with, you're right, mold patients who are basically always anxious, always panicking. And
yeah,
again, from the sound of it, uh, a good candidate for this would be high and low cortisol curves that we always see in hormone testing. So that also is
sure,
another thing that I
absolutely.
was thinking about.
Yeah.
But
So mold is for sure like it's such a neurotoxin. It's terrible. And it drives a histamine response that's chronic. So it feels like and then it develops anxiety. It's hard to separate them.
right,
So when dealing, and I work with a lot of people with mold too, and so what I do is I put them on a protocol to get out of the mold and then remove whatever has if I need to do functional testing and look for mycotoxins and figure out whatever. I don't write prescriptions, but I partner with functional med doctors that do if that's necessary. But all while dealing with the mold and all while dealing with any detoxification protocol, if you add the neurofeedback in, it is that supportive element that helps the brain and the central nervous system kind of like calm and regulate while you go after removing the neurotoxin. Because sometimes the removing of it and the process of going through it and all of the overwhelm to the stress response because the body's dumping all the mast cells and the histamines and the Herxheimer reactions hitting and all of that, it overwhelms the system more. And then people quit because they feel too sick to continue. So if you can offer neurofeedback as a way to calm and regulate the nervous system while you're treating all the physical issues, it's a beautiful thing to do together. It's very integrative for sure.
all right. Well, thank you so much, Dr. Marley. I think you got all my questions out. So great presentation.
Yes, thank you.
Thank you. Well, if you would like a system in your clinic, you let me know. I'll make it happen.
Yeah, leave your contact on the chat here
Yeah,
for our
Okay.
audience too.
we have it.
Yeah, it should be on that last slide. Let
Oh,
me
is it?
pull that up here. If you want to screenshot it, here it is.
What uh what about TMS? Any comparisons at all? Transmagnetic stimulation?
Yeah, there's I think that for depression, I mean they're very separate in what they do. You're talking about the magnet therapy, right?
Right.
Yeah. No, it's just different. I mean, that is again, that's stimulatory to the body. I don't touch that because as a naturopath, I'm looking for things that don't stimulate or augment. So, but I've heard amazing things, particularly for depression with TMS.
Mm-hmm. Okay. Okay. Um, I'm pretty sure you answered this. What's the process to become a trainer? Get in touch with you.
Yeah, no, you if you're it's funny because like if you're in Europe, like for some reason, people in France particularly, they will do the certification training, learn all about it. It's kind of like they go to college and then they launch their business.
Mhm.
So, a lot of people want to buy a system and use it and then become certified so they can offer it professionally. And so, yeah, I do offer the certification courses. I do them quarterly. But I mean, if anybody on this call was like, yeah, I'm ready to get a system and I don't have anything on the books and there was enough of you that want to do it, I would just get on here and create another Zoom. It's a 2-day training and the certification is like 660, I think, US dollars. And then you can offer it professionally. And then of course, you're part of the Zencar community and they help promote you for people that are looking. A lot of people find they're looking for providers and they'll either Google search or they'll get online and look for a trainer in their area.
Okay. 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 Any other questions, anybody? Thank you so much. We will be in touch. I'll get you the contact list for all of our participants, and what we usually say
Okay,
is
that's
that
great.
um,
And
yes,
can I send you can I send you an email, Dr. Clearfield, because I wanted to send a link actually because I think it would be helpful.
Mhm.
The five-phase model that Dr. Bill Brown developed, he actually has written an article in concerning Lyme disease, and this is kind of a new thing. And so I wanted to make that available for your clinicians because, I mean, obviously Lyme has affected me in my life since I have chronic Lyme. But
Mhm.
I thought that article might be helpful, and I had just actually received it today, so I wanted to provide it for your docs.
Can we put it up on our website? Is that okay?
Yeah, absolutely. I'll just it's on my website, so if you want to point it to that or if you wanted a copy to download either way,
Okay.
but I
Okay.
can send you the link. Okay.
Got it. Okay. Thank you. All right.
Thank
Great.
you so much.
Okay. Thank
Appreciate
you.
it.
Okay, everybody. Next week, we got an old friend, Dr. Hakimi, is going to be here. He's going to be talking about constitutional homeopathic interventions. So that's next week. In 3 weeks, you're all invited with a discount, like April 24th to the 27th, to the Age Management Medical Group at the Doral National Golf Club in Miami. I'll be the leadoff speaker there. I'm speaking about basic hormone optimization for men and also about the microbiome, which you all heard a couple of weeks ago when I had to do a substitution. So, and I know AMMG or A4M is the same weekend, so we're planning on meeting up with some of the folks from there too. Anybody has any programs or any events coming up? Please let us know. John, you want to talk about the thing that we're planning in West Virginia the end of May?
Yeah, sure. I sent you a lot of information tonight that I also sent to Dr. Tano. He's going to make an invitation video, and this is basically going to be a 3-day conference of our AOSRD here, also known as AOSIM, and they will be sponsoring the Clearfield Training Project, which will be a very broad, advanced. Well, it's what it is. Without you, Bill, we wouldn't have anything here, so it's
I think Dr.
appreciated.
Nario has taken the baton here, so I'm gonna.
Well, he's then we can put him in there too. But it's rather detailed. The invitation will get out very specific. I sent all the specifics to you tonight, Bill, so
Okay.
you can share with whoever you like, and
Okay.
they can decide if they want to go or not. But some very wonderful things have happened with this venue, and they're even talking about making us partners. And when somebody puts $500 million into a project and says they want to make you a partner because they like what you're doing, we're all ears. So it's going very well.
All right. Sounds expensive.
No, no, you know what? I didn't charge anything this time. The only expense will be for your airfare, your hotel that's there with this part of the project. This is a 500-acre all-inclusive facility. So the best food in the world is found there, 3 major meals a day plus, and you have nice housing, and it's under top secret security guard. So it's not the kind of place you would casually go. This is where the presidents land their Ospreys, presidential helicopters, and such. Very, very nice place, but very tight security. So we'll do 2 days there formally, and it's a like Doctor Strangelove atmosphere.
Mhm.
The auditorium we rented,
You're not going to do what
and
you did when you went to the airport that time a couple of years ago, then, right?
no, I'm trying to be so nice, man, so we can do this in the future. And so far, so
Just
good.
want to
They've
have
even
to mail you out of the who's gal.
they already agreed to give us major camera work and camera cinematographers to shoot the video we're going to shoot. So all's going very well.
Hmm. Okay.
And we might we can charge for something in the future. This time, there's no charge where we put money in our pocket. It's going to food, it's going to housing. That's it. The rest we provide for nothing, even the entertainment.
We got entertainment. Okay. Okay.
Yeah,
Now,
we got to figure it out.
Dr. Naria, what's the Dr. Andrew Weil tip of the week?
Well, the tip of the week is so we had a class that we had a shaman that actually did I guess a ritual to us.
Mm-hmm.
So the ritual was drumming. So the basic principle of drumming really is it's actually engaging your left and right brain hemisphere, and it actually brings you into that state of altered state of consciousness without using the ayahuascas, the ketamine. So this was a drumming session that we had, and this actually was very eye-opening because I mean, I got into this higher state of consciousness, but my classmates after after the whole session, they were crying. They were even documenting that they were seeing people who passed away in their lives and actually were communicating with them. So this was really something, I mean, this is not in the realm of our regular medicine talks, right? But for me being brought to this specific exposure, it gave me another perspective that there is medicine out there that we are really not touching yet. And
By the
these are the things that really you don't get in the clinic. And these are things, special things that you get from like this special program. To be honest with you, these are my classmates who are cardiologists, rheumatologists, who are, when you think about those specialties, they're in that very conventional bubble that who wouldn't even believe what integrative medicine is. But they're the ones who just flipped around and actually experienced these special moments that I myself was dumbfounded. So, but anyway, my point there is drumming is something that shamans do, and this actually releases a lot of endorphins, and it's called the drummer's high, like a feeling of euphoria when you do that. And that also is Dr. Halas's favorite, I guess, hormone, oxytocin, gets released. So that feeling of healing and elation starts to happen in you, and you just get into the system. So that's more of a personal experience that, not
we
much
should,
learning, but experience.
we should say that we are going to have drumming sessions at our May 30th,
Oh,
31st.
there you go.
It'll actually be on one day. It'll be a lot of one of our days is going to be very Native American with nature and mindfulness. We will have drumming there. And by the way, Kent Crowley is going to be one of our lectures there on some of the natural treatments. So drumming will be part of our session. And usually it comes from the Lakota Nation, but they all get together for the powwow. So it's a beautiful thing. And yes, you will cry.
Yep. I trust me, it's a totally different experience. It's a good experience.
We actually did
Very
in Wilkes-Barre, Pennsylvania. We ran it at my office once a week, a drumming session. We did it for about 2 years, and it was kind of an eye-opening thing. Some of it was, I don't know, a little bit, smarmy, then they would all, start talking about their lives and whatnot and whatnot. So I have some experience with that. So
Oh, there, yeah. It's good stuff.
okay. All right. Just so Dr. Marley, thank you so much for everything. In the chat there, she has it's $10,000 about for the professional system certification is $660, which is for 2-day session, which is pretty darn reasonable. Says about 12 to 15 sessions for adults and less for children. There's contact information here, and we'll put it up on the website if anybody wants that. And also there's a link from a article from a Dr. Val Brown. Okay. If you're anybody else have any comments or questions for our guest, please join us again sometime in the future. And we're here every Tuesday night if you're interested in what we're doing. Every Tuesday night, same time, same station. We've been doing this since October of 2020. And I think we've missed two Tuesdays. It was holidays in 4.5 years. So so we're going strong. So and there's a link. It says neurofeedback in Lyme. I can't click the links or else I'll break the connection. So I'll let you guys out there do that. So okay. Anything else? Dr. Quinn, how's the research group going?
Going well. Going well. We're pushing ahead. We got a major focus going on for the meeting in West Virginia right now. But otherwise, we're all still going, and I've had an occasion to have somebody else come into the thought process of a research thing on collagen. So we'll see where that goes.
Okay. All right. And how about Dr. Tano? I see he's on here. I don't know if he's got anything for us this week. So I know you're out there, Dr. Tano.
Oh,
Keep our
Dr. Clearfield, I
communication.
just wanted to apologize.
Yeah, no, I
Last
know.
time I
I know
couldn't.
you're shy.
I'm really, I was so tired. I
Yeah.
had clinic. I was so tired I couldn't really do it.
Yeah,
But
I know.
I promise you, on the
Oh,
third, I will.
Last week, no, don't worry about that. We're good with that. We're
Yes.
Dr. Burgess is pressuring you to do some sort of video so we get the word out about this conference. So
Oh, yeah. Yeah, that is in the works. Yes.
okay. All right, everybody. Thank you all. And, I see, a few new names, and thank you for being with us. And bring one friend. I always like to say that, and we'll double our census. We had a pretty good crowd tonight. And like I said, next week, constitutional homeopathy. So, it's not one size fits all. So with that, we'll say good night, and we'll see you again next time.
Thank you.
Video to you, Dr. Marley, as soon as it's ready, and also the participant list.
Thank you again so much for the opportunity to